With one button, I've opened up the 7 tabs that every GP in Australia needs to have open at the start of their clinic. And if you want me to show you how to create this kind of button for yourself with Stream Deck, just feel free to leave a comment below and I'll see what I can do for you. In the video, the 7 reasons why you are consulting slow as a GP, and I will include a link in the description below. One of the reasons is to know your guidelines. And if you don't know your guidelines, then just make sure they are open in front of you so that you can easily access them, even mid-consultation. And having worked in Australia for a little bit now, I have realized that there are 7 websites that I pretty much want to have open at the start of every clinic. Now, just bear in mind, some of these websites are free and some of them do require a subscription, but I will guide you through all 7 of them. Let's start with one of my favorite websites, which is Health Pathways WA. Now, one of the best things about this website is that it is completely free as long as you know the username and the password. And one of the best things about Health Pathways, and specifically about Health Pathways WA, is that there are a lot of local referral pathways here, and I find the guidelines very easy to search for. Now, you can either choose to find the guidelines here on the left-hand side, but to be honest, this is one of the best websites when it comes to its search function. Common one that I will look for are UTIs, lower UTIs in women. They do have a bit about enuresis in children, which is really, really useful. And the way that these guidelines are structured is really, really helpful. You will pretty much always start with a history. They'll have some bits about the examination, and they will talk about investigation, whether required or not. Finally, once you do that initial bit, they will have bits about management. And although it can take a while to run through these guidelines, they are really, really well written, and they're again completely free. Another one that I often look up here is HRT, menopause hormone therapy. Sometimes it can be a little bit tricky to remember which ones you're using depending on when the last menstrual period was. And again, it's all written out here in the Health Pathways guidelines. And now another really interesting thing about Health Pathways is that they have recently updated their transgender health and gender diversity guidelines. And I'm not sure this is covered in many other places. So if you are someone who's interested in transgender health, this is definitely the place to go. So if you are a medical student or if you're just starting out, maybe your cash flow situation isn't so great, definitely sign up to Health Pathways and just start familiarizing yourself with the more common conditions. Now, the second one that I will often use is ETG, which is the therapeutic guidelines. Now, unfortunately, this does require a subscription and it is about $400 a year. However, it is obviously tax deductible. I won't show you my password here because you can only have one person logged in at the same time. An alert will pop up and it'll say you have to log that person out. Now, I will often use therapeutic guidelines if I'm looking for something a little bit more specific or a little bit less common that might not be covered in Health Pathways. Now, when I'm using therapeutic guidelines, I will often use it for things like antibiotics. Although I did look for UTIs in Health Pathways, that is also okay. But I get the sense that therapeutic guidelines may be updated a little more often when it comes to the type of antibiotic that you want to be using. So if I'm looking for otitis media, for instance, the search function is pretty good in ETG. For some reason, I do find it better in Health Pathways. But you just click on otitis media. There's generally a lot of information here, and the graphic interface is quite friendly. So here you can read about diagnosing otitis media. And then finally, if you want to know about the antibiotic regimens, they're right here. And they're very, very clear. So I will often use ETG as well if I'm looking for something that may not be that common and isn't covered in the Health Pathways guidelines. A good example is antivenom. I recently looked this up, and not because I had a patient who was stung by a box jellyfish, but being new to Australia, I was really curious about this whole antivenom thing and how it works. And obviously there are some guidelines for this. There are 30 chapters here. First one is about snake bites. Now, depending on where you're working, this may be something that you have to familiarize yourself with. There are a lot of different snakes in Australia. As you can see, tiger snake, brown snake, polyvalent antivenom, where you don't know what the snake was. So yeah, there are different antivenoms that you can use. Another condition that I knew absolutely nothing about and had to pretend I knew what I was talking about when the patient came in and asked about this is altitude illness. So they wanted a prescription of Diamox. I had no idea what Diamox was, although there was something in medical school about brain edema, I think. I'm not entirely sure. But yeah, you just scroll down to the specific drug treatment and here it is. Here's the dose. We kind of went through the general treatment, prevention of altitude illness. I pretty much turned my screen and just showed the patient what we have in terms of the guidelines and sorted out a prescription for them. Now, the third tab that is super important and again, completely free, and it's absolutely amazing, is the STI guidelines in Australia. And the way that I generally use this is we have a lot of patients who come in and they just want a standard STI check and they're asymptomatic. So there's no urethritis, there's no penile discharge or other symptoms related to STIs. And it will say exactly what you need to do. And I found that really, really useful. There's bits about blood testing, there's bits about gonorrhea and chlamydia testing. Now, the cool thing about this as well is that if you have certain syndromes, a good example is penile urethritis. A patient comes in and they have pus basically coming out of their penis. This is a really great website to know which test to request when you click on diagnosis. And this really came in handy because I personally thought that I would just check for chlamydia and gonorrhea, but I also added in a mycoplasma, and that's the one that came back positive. And then if you want to know how to treat it, you just go down to the management, and depending on what you're dealing with, there will be different antibiotic regimes. I've noticed that both Health Pathways and sometimes ETG will refer to this website, and it is again completely free. The one thing I'll also mention very briefly when you are dealing with STIs, and you might already know this, is there's an awesome website called Let Them Know. I'll just briefly show you what I'm talking about. letthemknow.org.au. And the cool thing about this is that this is a way to instigate contact tracing, and the patients can do this, and it's completely free. Basically, patients will write in the mobile numbers of their previous sexual partners, and those partners will get an anonymous text message letting them know that they should really get checked out for STIs. So although I didn't include this in the 7 tabs that you need to have open, this is just a little extra tip. Number 4 is the Royal Children's Hospital Melbourne guidelines. And these are really great. And the reason I've included these is that we actually used to use these guidelines in the UK when we were dealing with conditions that weren't actually that common, and they pertain to children, obviously. And I found they had a lot of great information about penile conditions in little kids, something that we maybe don't talk that much about, but this is the website that had by far the best guidelines for those kind of things. The search function is so-so, to be honest. So what I often will do is I'll go under P, and we were talking about paraphimosis with one of our patients. And I feel this is something that we used to talk a lot about with patients, especially with parents, little boys, who might have had these ideas from the past that you really have to clean out the foreskin very well every time you bathe your child. And essentially, we talk a lot about how that is completely not necessary anymore. And a lot of those boys ended up having issues with their foreskin because you are effectively forcing the foreskin back to clean it, and some scar tissue can develop. And so this is a really great website to go through the guidelines with the parents and just let them know that actually you don't have to pull back the foreskin, and the foreskin will just naturally come back itself. Another great guideline that I use from this website is the constipation guideline. And I'm going to show you what I'm talking about here. Constipation is so common in kids, and I find it's really great to have these guidelines in front of you just to make sure you're not missing out on any red flags. And also it's really great to have the disimpaction regimes. And this is what I'm talking about, especially when you're using things like Movicol or Junior Movicol. The appendix is really, really useful. I find something that happens quite a lot is that patients are started on laxatives. Their kids are started on laxatives is what I was trying to say, but they're just not on the right dose. And more often they're not, they're a little bit older, but the dose is still very small. So I find that these guidelines are really great just to make sure that the kids have the right dose depending on the age. So we're talking about Movicol. And again, if you have a 6-year-old or a 7-year-old, well, they really should be having 2 sachets daily, even going up to 4 sachets a day. And again, if you scroll back up, they have the disimpaction regimes, which are really, really useful. Again, that's a little bit of a tricky consultation because you are trying to explain the concept of overflow and the idea of giving a lot of sachets, and things will get worse initially, but then kids will have a massive blowout. I'm sorry, we're getting a little bit graphic here, but I just want to explain what I'm talking about. Now, the 5th website that I always have open, this is unfortunately a paid website, is the GP book. I find this super, super useful to understand which specialists have which special interest. Let me explain what I mean by this. If I'm looking for an orthopedic doctor somewhere near Fremantle, so it says here orthodox, no, that's not what I was looking for. Orthopedic surgery, okay, that's what I'm looking for. I want to know which of these orthopedic doctors deal with hands, deal with shoulders, deal with hips, and deal with knees. And as you can see on the right-hand side, most of these specialists have specified what their expertise is in. Now again, over time, as you develop your practice in the place that you're working, you will get a sense which of these surgeons are the really good ones that a lot of patients go to. But I often use this just to get a little bit of a reminder. Obviously, you get letters from specialists, and then you speak to patients and they're like, yeah, this specialist was really, really great. And so by looking at the names, it can kind of remind me of who we're talking about. And if you are a GP whose partner is a specialist and they do private work, make sure that they make their profile really, really great. And what I mean by that is add in as many special interests as you can so that it's much easier for GPs to refer to you. Now, number 6 is PRODA, and a lot of GPs at our practice have this open at all times because they're doing a lot of authority scripts. I'll show you what I'm talking about here. If you log in and get through the 2-step verification, of course, you can go into HPAWS, go to service, go to my programs, go into PVS authorities, and request authority. Now, if you want me to create a video on how to do this, I can definitely do this for you. From here, it's pretty much self-explanatory, but if you're not sure, just leave a comment below and I'll sort something out for you. Now, this is something that I discovered just recently. Typically, I will call that special telephone number and ask for authority, and there's someone who kind of types in these various bits, and then they spit out a number for you, or they say this patient is too early or that kind of thing. But you can actually do that yourself if you don't feel like talking to anyone. And so that's what a lot of GPs at our practice do. They just request their own authority. It is super fast. It's lightning fast. You basically put in the details, you press request authority, and it spits out the number. Now, the last window that I always have open, and that is probably the most important window that you can have as a GP, well, it is Google. Because to be honest, everything is on Google. Well, that isn't in those last 6 tabs that we were talking about. But there are often things that aren't in any of those tabs that aren't in health pathways, aren't in ETG, aren't in the ICH guidelines. You just have to have a look, basically. Now, I will often use Google for back pain exercises. There used to be this really great website in the UK called Arthritis UK or Versus Arthritis. This is the back pain exercise sheet that I will often print out for patients. Again, often they will go to a physiotherapist, but whilst they're waiting to see a physio, I find that this is a really, really great patient information sheet. And the reason why I find this really great is I've actually done these exercises myself on occasion, and I find the exercises really, really help. So this is something that you may want to use for your patients, or you may want to secretly use for yourself. If there are some websites that you find are super, super useful and you want to share with everyone else, please leave a comment below, and then we can build up a little bit of a database under this video of different resources that you use as well. Otherwise, good luck.